So just getting to after the surgery, and I often stress to all my patients that the surgery is really only part of the battle, and the post-operative care is absolutely critical to get the operation to be a success. So, this is where you have to work very closely with your patient to make sure that they optimize their recovery. Just overnight, I get them to rest on 2 to 3 pillows, and I don't like to have my patients lying too flat after trabeculectomy, just in case there's any problems with too much drainage through that little trap door that we've formed. So I get them to rest on 2, 3 pillows. Some patients have even used like a recliner chair to rest, and they find that positioning more comfortable. But the whole idea is not to lie too flat. I see them the next day, and I take off the iPad and shield, and just to check the eye, check the vision, and check the eye pressure. And this has to be done very carefully, and I often advise my assistants who are very experienced in looking after people on that first day to be very careful when they remove the iPad and shield, and even checking the vision. I always let people know that the vision's going to be a little bit blurred, probably less than what they experienced immediately before the surgery, and I always tell them that before I take the iPad and shield off, because it can be a bit alarming. Patients expect that the vision's going to be clear once you take the pad and shield off, and it can be quite alarming if they realise that their vision's quite blurred. So always let them know beforehand. And even checking eye pressure, I usually do that myself rather than get any of the assistants to do it. I just don't want any excessive pressure on the eye post-surgery, because certainly in the early days of surgery it's very delicate, being held together by your sutures, and it's probably not till a good week or two that the healing is starting to kick in and the eye is becoming stronger.
I'd agree with all of that, Graham. I mean, I actually tend to use one of the post-operative medications I use actually dilates the pupil a little bit, and that relaxes some of the muscles inside the eye and relaxes the eye. So it's a bit like when you have your pupil dilated in clinic. Things are a little bit blurry, and that's absolutely normal, as you say, to be a little bit blurry in the early post-op period. Additionally, I really strongly advise people not to squeeze their eyes. So when people screw their eyes up, that can break the gentle stitches that we use. And it's quite fascinating, but when I was a child, we had the story of the fable of the emperor's new clothes. And if I was to hold a 10 centimeter piece of suture material in front of your face to a patient and say, here's the suture material, it would look like I'm holding nothing because it's so fine, but it is there. And it's very easy to break the stitches by rubbing the eye or screwing the eyes up or squeezing the eyes. And so I'm very particular asking patients not to do that. And particularly when they put their post-operative drops in, not to press on the eye. I think these things are very important.
Just about the vision too, like trabeculectomy is one of those operations where the vision can fluctuate quite a fair bit, especially in those first few weeks. Some days the vision will be reasonable, other days it can be quite blurry, and that will depend very much on whether the pressure is a bit high or a bit low. And I always like to tell patients that it's the usual run to have the vision fluctuating. It can change from day to day, and not be too alarmed by that, because some of them had cataract surgery before, and with cataract surgery there's a very rapid recovery of vision. Often they can see reasonably well day 1, day 2, but trabeculectomy is not that type of surgery. It does take time for the vision to stabilise.
Absolutely. Yeah, no, I fully agree with that.
So post-surgery, the first 3 to 4 weeks is crucial to adjust the flow through the fat valve, and as I said, I think it's just as important as the surgery itself. If the pressures are too high, you taught me many years ago the releasable suture technique, and the sutures are put in such that we're able to release or take them out after the surgery, and we can do that in clinic. We don't need to actually go back to theatre to do this, and the whole idea of the stitches is to hold the flap valve down. So usually we put 2, sometimes 3, sometimes 4 releasable sutures in, and that way we can just titrate or just gently control how much fluid's coming out of that trapdoor, and drop the pressure whatever it needs. The issue too is if the pressure is too low, and sometimes patients occasionally that they can sleep on their eye overnight, and they wake up with blurred vision in the morning, and that's why wearing the shield at night is so important, especially in that first month or so. Sometimes, as you mentioned, there's a risk of them rubbing their eye or partner bumping them in the eye, and that's again a situation where there might be excessive drainage through the trapdoor and result in the pressure being too low. Oftentimes the pressure does come back up and there's no need to do any active intervention. But if the pressure remains too low, if there's too much drainage through that trapdoor, that's when we may need to go back to theatre. Basically, we put more sutures in the trapdoor to slow down some of that drainage.
I agree with you about the shield, Graham. I think, I do understand it's very difficult for patients in the early post-operative period. This is a big operation, and there's a lot to do, but it's really important to wear the shield at night. I've seen a young man once who drank too much just before he went to bed, and he was drunk, and he forgot to put his shield on, and he slept face down, squashing his eye all night, and really did his operation a lot of damage. And it's such a pity when you've got a good operation that's working to damage it just because lack of discipline, really. And so the things that you and I advise for our patients, we've learned over 25 years. We've seen other surgeons run into trouble. We've seen patients run into trouble. We've seen our own patients run into trouble when they don't get things right. And so the measures that we suggest and offer to people are designed to keep them as safe as you can be. And it's really important not to lose discipline.
What do you tell patients about that adjustment of the pressure after surgery?
Well, I think that the most important thing I can tell them is that it doesn't hurt. Because if you think about anything, if you have any stitch taken out of any part of your body, it's no fun at all, and it does hurt. But the beautiful thing about eye stitches are they're so fine you can barely see them. And when you take them out, patients virtually feel nothing. So I tell them not to be scared if you need to have a stitch adjusted. It sounds like having an eye stitch adjusted is not much fun, but actually, after you've adjusted it, most people say, I didn't even feel anything. So I try and reassure them about that. And certainly you're right, these releasable sutures are fantastic because they allow us to control the way the eye drains fluid and wherever possible to try and stop too much fluid draining. But occasionally too much fluid will drain, particularly certain types of eye. Some eyes are not very rigid eyes, they're quite soft eyes, and they have a tendency to drain too much. And so sometimes it will be necessary for safety reasons to go back to theatre to put extra stitches in, or sometimes to inject a small amount of a special jelly into the eye.
Yeah, fortunately, it doesn't happen too often, and often we tend to start at maybe a slightly higher pressure and bring the pressure down that way. But the whole thing is to get that flow going, isn't it? To make sure the flow is established in those first 3 to 4 weeks, and that really sets you up for longer term success.
Absolutely right.
So getting to potential risks, this risk of infection, and admittedly the risk of infection is the same with any sort of eye surgery, and fortunately for eye surgery, it's done in a clean, sterile theatre environment. So really we're very lucky we've been able to keep the risk of infection to a minimum. With bleeding, trabeculectomy is one of those operations where you are making incision into the conjunctiva, and the conjunctiva, the surface tissue of the eye, has a lot of blood vessels. So when you're actually cutting through those blood vessels, it's inevitable that you will get some bleeding. But yeah, if you're actually on some sort of blood thinning agent, and we're talking about things like aspirin, warfarin, other platelet inhibitors, anti-inflammatories as well, they're all going to increase the bleeding time. And I think if you want to optimize the bleeding status, if you can stop these agents a week prior, and it does depend on whether it's medically possible to do this. Like some patients, because of their heart or risk of stroke, they're not actually medically able to stop their blood thinning agents, and this is something that you need to discuss with your surgeon and discuss with your physician what the safest alternatives are. They often neglect to tell us about the supplementary medications, things like omega-3, fish oil, ginger, ginseng, ginkgo, that they all can cause increased blood thinning. So it's very important for our patients to let us know if they are taking these supplementary medications, and preferably stop them prior to surgery. And then other risks include problems in the back of the eye, and more specifically, we refer to problems with the retina. And these are things like bleeding can occur in the back of the eye, and also things like retinal detachment, where the retina physically can come off from the inside of the eye. But fortunately, these risks are potentially preventable, and we do everything we can to avoid these risks. As you were mentioning early on, we're looking at success rates over 90% with most surgery.
Yeah, I think there's some very important points there, Graham. I mean, what I always say to patients is that when I'm consenting them, I say there really are just two major things that can cause devastating and fairly immediate loss of vision, and that's infection and bleeding. And that's why we spend so much time as surgeons trying to help our patients and thinking about it. So when it comes to infection, always tell your surgeon if you think you're developing a cold. Sometimes people have built themselves up for the operation and they really want to have the surgery, but they know that they're getting a cold or they've been exposed to a virus. And the problem is, if that cold gets worse or they develop flu in the early post-operative period, you can lose the eye. So if a surgeon cancels your operation, there's a damn good reason for it. And same goes with cough. Every time you cough, you're at risk of a sight-threatening bleed in the eye. So you must not go ahead with surgery if you have a cough. So those things are very important, and likewise infections elsewhere in the body, dental infections and infections on the shin, for example. As Professor Lee mentioned with bleeding, you really must take advice before you stop anything that thins the blood, because your body may be used to it. And for example, you may have had a particular type of pacemaker or a particular type of stent put into your heart, and you have to take very careful advice about what is safe to stop and not. And I think you made those points really well, Graham. And really, if you can help your surgeon to reduce infection and bleeding, then you're going to do very well. And your surgeon may well work on the ocular surface of the eye, sometimes for a month or two before you have your operation, getting conditions like dry eye and blepharitis sorted out. And these things are very worthwhile doing. And then in the post-operative period, you can help your surgeon with meticulous hand hygiene. So I ask my patients to just go to their local chemist, and you can buy some simple hand gels, antiseptic hand gels, and you keep them dotted around the house so that you're always keeping your hands clean, trying not to touch the eye or the face during the day, and particularly having clean hands before you put your drops in.